Let's paint a picture. It's 7 in the morning and your child tells you that they have a rash, or you notice one on your child. What do you do? In rare circumstances, a rash in a child can be life-threatening. I stress this is rare, but it's one of the most important things to be able to spot as a parent. There are some telltale signs to spot these worrying rashes, and I break these down for you at the end of the video. But for now, let's talk everyday rashes. One of the best ways to look at common childhood rashes is to break them down into 3 different groups. Rashes with a fever, rashes with itching, and rashes without either. Rashes without fever or itching. Let's start with rashes with fever. This is quite a dramatic, bright red rash on both cheeks, often during or just after the symptoms of a cold, like a runny nose or sore throat. It rarely spreads to the body and goes by itself within a week or so. No treatment is needed other than managing the fever and using a cold flannel on the cheeks if they're hot. By the time a child has the rash, they're no longer infectious, so they don't need to be kept off school. If you thought slap cheek syndrome was a bit on the nose, then this one really takes the biscuit. Some highly creative individual came up with the name hand, foot and mouth disease because, well, you get blisters on your hands and feet and ulcers in the mouth. This also happens during or just after the symptoms of a cold and disappears within a week with no treatment required. Kids should stay off school when they're feeling unwell, but they can return when they're better or if the fever's subsided, but you don't need to wait for the blisters to fully heal before sending them back. This one usually starts with a sore throat and a swollen tongue, especially in kids between the ages of about 5 or 10, before showing up as a pinky red rash all over the body that looks like sunburnt skin and feels a bit like sandpaper. This rash, unlike the others mentioned, is caused by a bacteria rather than a virus, and it does respond to antibiotic treatment, so you do need to reach out to your GP in this case. Kids should be off school until either the fever stops or at least after 24 hours of antibiotic treatment. These are small red spots caused by heat and sweat, something to look out for if your baby is scratching, as it's a common cause of discomfort in kids. It clears up when the heat is removed and no other treatment is really needed. Eczema is really common. 1 in 5 kids suffer with this, and it has so many different forms. This is your classic itchy, dry, sometimes cracked skin, and it's usually found behind the knees, elbows and neck, but it really can appear anywhere. It tends to come and go, so it's not unusual to suffer with this on and off throughout childhood. Mild eczema can be managed with bathing and creams, but more stubborn eczema definitely needs steroid and other slightly stronger creams. This one forms an itchy, ring-like rash caused by an overgrowth of fungi, normally found on our skin. It is contagious and it can be passed on to other people via touch and towels. It can easily be treated though with an antifungal cream for a week, so do speak to your pharmacist or GP if you notice this on one of your kids. Have you ever been stung by a nettle and noticed those raised, sometimes red, itchy wheals? This is what a hive looks like, and it usually occurs due to an allergic reaction to things like stings, medicine, or food. The medical name for hives is urticaria, which is actually derived from the name of a common European stinging nettle. Hives usually clear up within hours or a few days, often without the need for treatment. If they do persist though, speak to your GP as your child may be allergic to something. This is caused by a virus that results in blisters on the stomach, back and face, and then it spreads all over the body. The blisters eventually scab off, but this can take a few weeks, and in some cases it leaves permanent scars. It's highly contagious and children should be isolated from school up to 5 days from the onset of the rash, as well as from people that have a risk of catching it, such as newborn babies, elderly or pregnant women. And if they get it, they may suffer some ill health as a consequence. This causes red sores or blisters that burst and leave crusty golden brown patches. They often appear on the face, hands or around the middle of the body. They're caused by a bacteria found on the skin and require antibiotic treatment as well as antiseptic wound cleansing. Impetigo is really contagious and it can be passed on to others through close contact and towels. School should be avoided until the crusts have fully dried out or 48 hours after you start taking antibiotic treatment. Scabies is probably the itchiest rash of the lot and is usually worse at night. It's caused by tiny parasitic mites burrowing into the skin, resulting in tiny itch spots on different parts of the body, about 2 weeks after infestation. It's very infectious and usually more than one person in the family has it. Children should be off school, but they can return 24 hours after the first treatment. Treatment is quite a faff though, with the commonest treatment being chemical insecticide creams applied to the whole body, including the fingernails and underneath them, and left for about 10 hours before you wash it off. Most of these types of rashes occur in babies below the age of 1 year old. The exception is molluscum. This is a common viral skin infection that causes small, firm, raised spots anywhere on the body. It usually affects kids under 10 years of age and it is quite contagious, especially during the first 2 weeks of infection. Having said this, with molluscum you don't need to have your child stay away from school as the risk of transmission is low. These are small white spots that can appear on a baby's face when they're a few days old. They're actually small cysts containing skin protein, and 1 out of every 2 babies are affected. They're harmless and they clear up by themselves within a few weeks. These are raised red, yellow and white spots and appear on babies in the first week of life. They're usually found on the face, body, upper arms and thighs, and 1 out of every 2 babies is actually affected. The rash comes and it goes quickly and it doesn't really need any treatment. You know you have nappy rash when you have red patches on a baby's bottom around the nappy area. The skin sometimes looks sore and it feels hot with spots and blisters, and it can make your child quite irritable. It's caused by wet and soiled nappies damaging the skin, resulting in localized infection. Treatment involves gentle cleaning, patting dry and allowing to air dry, and the use of protective barrier creams that allow the skin to heal. This looks like pimples on the cheeks, nose and forehead, and it usually appears in the first month after birth, and it clears up pretty quickly by itself. It's worse in baby boys and it's due to excess testosterone. There's no specific treatment, but washing your baby's face with water and a mild moisturizer can help. This is when a baby gets yellow, greasy, scaly patches on their scalp. It occurs in the first year of life, usually at about 3 months of age. It's caused by overactive sweat glands and it isn't harmful. If you did nothing, it will go, but to speed it along, you can do regular scalp washing with baby shampoo and use a soft brush to loosen the scales. You can also use baby oil if you like to soften the scales. So that's it. Those are the common rashes you can spot in your kids. At the top of this talk, I mentioned that there are some rare and serious rashes that affect kids. There are some telltale signs that a rash is life-threatening, and most of them actually don't relate specifically to the rash at all. You'll need emergency help if your child has a rash and a stiff neck, if they're bothered by light, if your child's confused or have a fever that you just can't control, or has cold hands and cold feet, or if they have a rash that doesn't fade when you press a glass against it. These are all signs of meningitis and sepsis, which is an infection in the bloodstream and/or a very unwell child. Thanks for watching. Till next time, stay healthy.